Hi, and welcome to this webcast. Our focus is going to be top health center focuses for HIPAA and security. My name is Joe Gellatly, and I want to start just by sharing that I've been on a board of an FQHC for about 12 years and have a high respect for what you do day in and day out. So thank you for your work and also for joining the webcast. We're going to talk through a few items around current threats and events that have occurred recently, and then how we respond to that as a healthcare organization. I am also one of the co-founders of Medcurity, and our mission is around protecting healthcare organizations by helping them protect patient information. And so this is our arena. This is where we spend a lot of our time. And so I'll start by going through the current landscape of some of the recent breaches and significant events, as there are some lessons we can take from those. And then we'll highlight a few specific threats that are important to be aware of, and then we'll go through and touch on a number of focus areas that would be important, especially when all of us are wearing many hats. These are a few areas that we really can't afford to miss. So hopefully you can pull some great takeaways through this and have some action items as we conclude. So to begin, we'll highlight just a few events here, and again, take away a couple lessons learned from these that apply to all of us in healthcare. I'm going to begin with the Anthem breach. This is a news item from this year. And again, all of these are in the news, so I won't spend a lot of time in specific details, but I want to just share a couple takeaways. With Anthem, it's a very large breach that's a little harder to relate to, but one of the important items that came out of studying that was that the penalty around a patient health information breach that occurred was $16 million. However, Anthem has shared that their total cost of the event was as much as 20 times that amount. And we've seen that at a micro level mirrored in other organizations that have had smaller events occur. The cost is always much greater than the fine. And so as we look through some of this activity from the Office of Civil Rights, we can see where the federal government is focusing, and we can see in the news story what types of penalties were assessed. But we also want to understand how we diminish that penalty, but also how we prepare ourselves and try to limit other costs that might occur around any type of breaches. So that's our takeaway on Anthem. It's just that a startling number from the Office of Civil Rights as far as the penalty goes, but a much, much higher total cost when they had a recent HIPAA breach. Another item that we were watching this year was the MD Anderson penalty, and I'll just continue around clockwise here. With MD Anderson, a laptop was left in the back of a car, and a couple thumb drives were lost as well. And so when those three devices were lost, the penalty came out at about $4.3 million. And what really occurred there as the government, as the Office of Civil Rights zeroed in on them, they found that there had not been an organizational-wide security risk analysis that's required. We're going to talk through some of these specific requirements that came out of these, but they found some specific items that should have been covered within an organization of that size. They assessed and decided, and so came up with a penalty that stood about $4.3 million. In Colorado, there was an organization that was using a Google Calendar for patient scheduling, and they had an employee leave, and they did not shut off access to that employee. So they found that the employee had accessed that schedule again and reported that as a breach to the Office of Civil Rights. The OCR investigated and found that the organization didn't have a business associate agreement with Google, and therefore shouldn't have been sharing the patient information on that schedule at all. And the penalty came from that. So one of our takeaways, again, as we start this off, is that with the spotlight comes the searchlight. And so you may be reporting one type of event, but that also can open up other discoveries when the Office of Civil Rights is reviewing. And so we're taking note of all this that we learned from the headlines and make sure that we cover our bases here. Similarly, above that, in Florida, there was a physicians group that had an event occur with a partner. So they had outsourced billing for a few months, and that billing partner had accidentally exposed patient information. But the penalty was around missing business associate agreement. So there was no contract between the billing company and the Florida physicians that could be produced, and therefore the physicians group was hit with a $500,000 penalty. And then finally, just a couple other items. We're seeing a significant uptick in ransomware events. So incidents where patient health information is encrypted, not necessarily removed from servers of a healthcare organization, but encrypted and made unavailable. And then, of course, a ransom request is made. And in some cases, those are paid. In other cases, backups can be restored. But Medcurity has been involved in helping following a number of ransomware events. So that's another item that we're going to just touch on some awareness and some activities that would be wise to implement. So again, just every year we try to look at some of the key headlines and see where the feds are focusing as well as where other types of events are coming up. As a side note, a ransomware event has been explicitly deemed a data breach by the Office of Civil Rights. Over the past couple of years, we certainly had some discussion around that, whether this is something that needs to be reported or could be considered. The ransomware culprits may not have viewed or removed that data, but we've still received explicit direction from the Office of Civil Rights that this is to be reported as a data breach. So if you were to get in a situation where you're experiencing this kind of attack, don't delay on your data breach protocol. Get that reported to the government and queue up your patient report, your reporting that you need to do, notifications to the affected patients, and so on. Just one slide on significant threats, and this you'll see is pulled from some of those headlines. So I'll go through this pretty quickly. Number one, we just have a lot more exposure from an electronic standpoint as we host more data in the cloud. And as more tools are used, and even employees may be coming up with their own tools that they want to use, or physicians have some tools that they're implementing, we have more areas where patient information may be stored, like the Google schedule with the earlier example. And that opens us up to more risk. Number two, we've seen each year an increasing dollar amount of penalties coming from the Office of Civil Rights. And we know that with that comes a public relations, management opportunity, and then also potentially other types of dollar amounts that have to be spent in remediation. Number three, while patient information has been a target for hackers for a while, its marketability is continuing to increase. So you'd think it may have been commoditized at this point, but patient information, because it's such a complete record of a patient, we've seen the price per patient record on marketplaces on the dark web. We've seen that dollar amount continue to increase because there's a number of ways to take advantage of patient information. So we're not seeing a decrease in the interest of hackers targeting patient information. Number four, ransomware attacks. We touched on that already. Seeing a sharp increase in those. And most of those, as you drill into the source, are coming from phishing emails. So not everyone, but that's certainly a key place to start. We've also seen VPNs that had been retired, so other ways of accessing the network that hadn't been completely shut off, and hackers can find those and take advantage of that. The ransomware attacks are leading to ransom requests that are increasing. We've seen as much as even up to $1 million. Typically, they're falling in the $25,000 to $150,000 range. It appears that the hackers assess the organization size and try to target a ransom amount that that organization may be willing to pay. Number five, we have more and more mobile devices and bring your own devices where we have more risk in a mobile standpoint. So those devices can be, as with the MD Anderson example, stolen out of the back of a car or lost. And if they had access to patient information, if they had any potential patient information stored on the device, that becomes a breach, with the exception of devices that are encrypted. And then number six, vendor accountability. At a very minimum, obviously that business associate agreement is critical, but we're seeing more accountability that healthcare organizations have to have for how their partners and vendors manage that patient information if they're touching information at all. So we're seeing that over the next couple of years, there's increased attention on how we as a healthcare organization need to hold our business associates accountable for protecting patient information. So I will walk through 7 focus areas that are drawn from what we've seen over the past year that would help us really begin to protect our organization as we need to. Number 1, broadly, the security risk analysis. So HIPAA has, in the security rule, required a security risk analysis on a regular basis since 2003. We also are seeing this now as an annual requirement from CMS as part of MACRA MIPS and other payment programs. So in the rule, we're required to conduct this on a regular basis and after any significant changes in our organization. Security risk analysis is not limited to technology. So where this becomes an assignment or responsibility of IT departments, often the scope can be reduced to just an IT audit where they're maybe walking through an assessment of their own infrastructure. That is very important. However, in the law, we're supposed to go through, in the rule, we have responsibilities to assess our administrative safeguards, which are largely policies and procedures that we need to have in place for our staff, the types of roles that we're supposed to have in place within the organization and the responsibility of those roles. Then we also have physical controls, so an audit of your facility safeguards. Now you're protecting physical access to your organization and physical devices and destruction of those devices when necessary. And as you step through the security risk analysis, the other very important item is to ensure that you are pulling a work plan from this. So it's not enough to just have this assessed by a third party or doing it yourself, generating a PDF report and storing that for a year. We also want to ensure that you're going to be able to show that you are continuing to improve, that you are looking at your highest risk items and working those and making progress each year. That is something that has come up in audits from the state, from the OCR, from other entities, where they not only want to see that security risk analysis, they want to see your work plan that followed that and the actions that you were taking. So if a breach was to occur, what we've seen consistently at the top of a request from the OCR is show us your security risk analysis, show us your remediation plan. The OCR shared that 90% of the time that they're assessing a major penalty, a security risk analysis had not been completed. They actually define it as an organizational-wide security risk analysis. So there may have been an IT walkthrough or an IT audit, but the comprehensive SRA is required, and it is one of the first places OCR looks to see if an event was the organization's fault out of negligence, or if we as a health center were doing everything we could, we were looking at risk, we were addressing high-risk items, and yet something occurred anyway, which was a very different penalty level and a different response from the OCR. Number 2 is policies, and health centers have some advantage here. Having been through HRSA audits for years, there's often more comfort level with the fact that audits are going to happen and the policies need to be in place. We have seen policies that are still in binders or in paper or have not been customized to the organization or reviewed recently. So policies are also an item that the OCR would ask to look at in a breach. And they're also just very important to have available to your employees so they know their responsibilities within the organization. And so there's a baseline of policies that need to be in place. They're all defined in the security rule. We're also supposed to refresh those policies on a regular basis. So one of the things you'd want to look for as you do a security risk analysis would be, when have we last updated our policies? If we have a policy saying we are going to keep everything current and look at it every 2 years, we don't want to have a last review date of 2005 on those. So that's an area that you would want to check through even if the policies are already in place. All right, so moving on to number 3, and we've touched on this a few times already, the business associate agreements are critical. With some of the changes in the past couple of years, you want to be sure that your agreements have a definition of the scope of work. So what exactly is this partner doing for you? How are they accessing patient information? How are they using patient information? We need to define that and put a scope and a limit on that. And so then that becomes something that you want to review on a regular basis as well. So every year would be great. Every 2 years, it's not specified in the security rule. We just need to set an interval of time that we review our BAAs and potentially update them and push them back out for signature again. But as I mentioned earlier, the BAAs are a first step. That's critical. Every vendor or partner that's touching patient information, we need to have this in place. But we also need to prepare as health centers, we need to prepare to go a little deeper here. We're being held accountable to what our partners do with that patient information. So there would be worth considering, are there additional questions that you want to ask your vendors? Anybody that's hosting your data on the cloud, or anybody that's using it in research or billing or other ways. We may want them to provide us with their risk assessment, or at least a letter attesting to everything they're doing to protect patient information. So this is something that if you feel that you've got the BAAs in place and you're looking to move up in a maturity level with your HIPAA program, this would be an area to begin to address. How do we hold our vendors accountable for what they do with the patient information? The number 4 item is data encryption. This is in response to the mobile devices that are present in many of our environments. This encrypting a laptop makes all the difference. And when the laptop is lost, what happens next? If the laptop is unencrypted, you have to analyze and estimate any potential patient information that could have been local. So whether it was emails received that are in a local inbox, scanned images downloaded, all of that, any potential information you have to report as a breach on an unencrypted laptop. So it's very important to ensure that all laptops, all mobile devices, any hard drives, etc., are encrypted. Number 5 is, as many of us are aware, employee awareness is critical. And employees, as long as we have humans in our workforce, this is going to be our top risk. I had a recent example. We worked with an organization that had been doing phishing awareness exercises, which is very important and a very good idea for all groups to consider. So they were sending out phishing emails, which are emails that were attempting to solicit a password or a username from an employee. And so they would send these test emails and see how many employees took the bait and gave their password, were tricked into this. And initially they had about a 10% conversion rate. That dropped to 1% through this testing and training cycle. Now that's critical, and we advise it always. In that case, that organization still unfortunately had a major ransomware event from a phishing email. So we really need to watch that, and even if you feel like that's not a huge issue with staff, anything you can do to have everyone be aware, and this is where that healthy paranoia comes in, to be aware and questioning any emails that are coming in, being very careful about opening any attachments or clicking on any links, of course. Another piece of this is encouraging reporting of events. Now this, we're talking about some major issues. If we zero into simply faxing a chart to the wrong number, we want to create a culture of compliance where that employee feels safe to report this to the compliance officer or the privacy manager and say, this is what happened, and have, in response, have the organization say, thanks for letting us know. How can we help you ensure that this doesn't happen again? How can we, let's look at workflows instead of, in many cases, instead of the employee, let's look at the workflow that led to this and see what we can do to improve this. So that is so important because you do want to encourage employees to report, not cover up any incidents that occurred, which helps you report everything on a timely basis. Okay, moving to number 6, we have an increased need for auditing. So we need to be aware, and this is a technical item as well as a workflow item. So certainly we need some review of the types of systems that can do threat detection. We need to be able to do penetration tests on a regular basis. So we need to be aware of activity that's happening on our network. So very much an item that would be owned by your IT department. We need to be aware and able to proactively respond to any unusual activity on our network or on our workstations. This is an area that allows you to get ahead of events sometimes. And many of these incidents that we've come in that have turned into major ransomware attacks or other events like this, the hackers had had a door or a presence on the server or moved to a domain controller months before the actual attack had occurred. So we're seeing a very critical need to be able to get ahead of this with threat detection and with the right tools in place to be able to see when you have unusual activity happening from anywhere in your network. But we also have the need to audit users, and this is something that is a pretty flexible requirement. It has to happen, but how it happens needs to match your organization and what makes sense. So this would typically look like, as a compliance manager, I pull 25 charts, or I look at 25 employees and pull their last week of chart access, or I look at any employees that came as a patient to my health center and make sure that the chart access for that employee was all appropriate. In some locations, we have the same thing with celebrities. If a known entity, a known person was seen in the health center, we would be checking to see if there was any inappropriate chart access there. So it is something that requires some creativity, but very important to complete this. Two pieces around this. Number one, you need to have a policy and a procedure that defines your chart audits, how you're going to do it, when you're going to do it, who's responsible for it. Number two, you need to log that audit and keep that log for 6 years. So if something occurs for the next 6 years, we as a health center, we're responsible for saying, yes, we were looking for this. Whether we caught it or not, we were doing a reasonable effort to try to identify and prevent any inappropriate chart views. And here's the proof. The security rule defines that retention period as 6 years, so that's your minimum to keep the ability to show your work around this. And that 6 years stands for many of the items we talk about through this. So if you update your policies, that previous copy of the policy, you're going to want to keep that around for 6 years. So that would be something that we need to be able to produce should there be a historic event brought up. Those logs for the system monitoring as well, whenever possible, that would be something that would be good to keep for 6 years. Okay, and finally, we're moving to event response. So this would include both a security event, and that's typically its own policy. So what do we do when we've found that we've been hacked, or we've had a ransomware event, or we've had a major breach in another way? What are the steps we take? Who owns this? All this needs to be defined in advance so that you can move swiftly when something occurs. How do we report this to the government? What is our template for an event notification to the Office of Civil Rights? All of this would be held in a policy for event management or event response. Hand in hand with that, we would have typically a disaster recovery plan that would say not just a security event, but any type of disaster that may occur that would restrict the ability to provide care. That is a very important policy and plan, and that often requires many aspects of the organization to contribute to. In the field, one of the things we see with the disaster recovery plan is that it was built and very, very solid, a beautiful plan from a clinical standpoint. So we as a health center, we're going to call in this support staff. We can move operations to this location. Just all of the considerations you'd want to have in the event that you were unable to provide care or access information, or some other ways you were restricted, or if something happened in the community that's driving an overflow of patients to you. These are things that we'd want to consider and plan for. We see the plans, but what is sometimes missing from those is the IT piece of that. And today we're no longer in a position where we could leave IT out of that, because when a plan is activated and an event is occurring, access to information becomes critical. So if you look at your disaster recovery plan as part of your risk analysis and say, yes, it's in place, it exists, and it covers everything around providing patient care, look for the IT pieces and ensure that they've been plugged in, that this is collaborative with your with all teams that need to be involved. because sometimes additional access needs to be provided in the EMR system, even if it's a cloud-hosted system that's available from anywhere. If additional access needs to be provided, who can authorize that? Is it different than your typical access provision policy? And then who's responsible for ensuring that that access is removed following the event? These are things that are looked for in audits, and they're just very important to have defined in advance because it can take some of the chaos out of an already intense situation. When you have your disaster recovery plan solid and everybody has approved it that needs to, on a regular basis it's important to run drills against this. And so we've seen sometimes perhaps an annual tabletop exercise. So say we're laying out some potential scenarios and rolling the dice and saying this is what may occur. What would we do? What actions need to be taken at this point? And then follow through with that whole activity. So your team is aware and it is fresh in their minds on what to do in various situations. That should include a backup drill. So backing up patient health, electronic patient health information is very important, and being able to restore that when needed. Even if your EMR is cloud-based, other patient information that you may have on local servers needs to be obviously backed up, but also restored on a regular basis to ensure that that data has integrity, that it's available as expected. That should be part of the disaster recovery plan. Testing that backup should also be something that you log, and you want to have, again, a 6-year period of time that you're maintaining that log and you're able to show that we were doing our due diligence to test backups. And again, it's a good process to prepare you to be successful in an event like this. It's also really important in the potential case that a backup could fail and that becomes a major issue, any kind of data loss when you're working with the federal government in an event. And we need to be able to show that you were doing everything you could to ensure that the data would be there and available to prove that this is not something, again, that the organization was negligent in, but something that occurred as a one-off event. So not what you want to be in the middle of or have happen, but it's important to show your work. Groups that are very good about testing backups may not be logging that, so that's something that we always advise. Keep a record of the good work that you're doing to ensure that all the patient information is there. The contingency part of this is, again, potentially showing how you would provide patient care in another location, how you'd make data access available to those that need it in that case, and then who would decide and when would you decide to move operations back. Okay, this slide has a number of small text items here, and I won't step through all of this on this webcast, but feel free to reach out if you want to get this list from me. What we wanted to show here is, having been through a number of audits for both state agencies and the Office of Civil Rights, what are some of the common things that they ask for after you have a major breach? And it's actually very much in line with everything we've talked about so far, because they're expecting you to have this ready. And I've seen pretty consistently a 30-day window of time that you have to collect this and send back to them. The first couple items are a narrative, so the story of what occurred, what steps you took immediately, what you learned about the event, and what should have prevented it from occurring. So safeguards you had in place, even if they weren't successful this time, what you were doing to try to prevent this before it happened. And then, of course, always the security risk analysis is going to be in there. They want to see that you were conducting this. Again, that makes a huge difference in the implications or the potential penalties around the event. And then not just that, but what is the work that you were doing to remediate what came out of that SRA. The rest are items like policies, procedures, and evidence that usually relate pretty closely to the breach. In this case, many of these are related to a ransomware or a hacking event. You'd see different policy requests if it was related to an employee accidentally dumping the shred bin in the dumpster or something of that effect. So, but there would be a request for all policies that may address pieces of that, and then almost always documentation on the training you've been doing for your employees. And I didn't mention it earlier, but it certainly needs to be an annual event, and you need to have an audit or a proof that all employees have completed that HIPAA training on an annual basis. Finally, just a few notes on what we're doing with Medcurity to help along these items. We have a platform that's cloud-based. It's all subscription basis, and it starts with that security risk analysis. So instead of conducting this on a spreadsheet, you or a third party can walk through this questionnaire, which is broken into the items that we're supposed to look at on a regular basis. And it's very quick to sign up for this and add users, so you can assign the IT questions to your IT department, physical questions to a facilities person, and so on. And then it guides you through all the areas we're supposed to look at in a security risk analysis. And for every question, we have a citation back to the security rule item that drives that, as well as a definition, an explanation that says, here's what we're looking for here, and here's what it usually looks like. When you complete that, you get a risk stratified report that is audit ready. It's everything that any auditor would look for in an SRA, but also your dashboard becomes a place to manage those items. So if you said, no, we're not addressing an area yet, a recommendation is created. You can assign it to team members, and you can track it until it's been completed. And then at any time, there's a button at the bottom that says print work list. That generates a report of the activities you've taken, the activities in progress, and it helps you, again, show your work. So in the event that you needed to show that you had done an SRA and that you had taken appropriate actions and you were working toward remediation, this is a dashboard and a tool that puts that at your fingertips. And finally, one of the areas we saw often with groups that we work with is that some policies may be missing or just taken from a binder or a book of generic policies. So we created all the key security policies we're required to have in a questionnaire-driven format. So you would answer a series of questions. And this is just if you had gaps in your policies and you needed this. You can answer a series of questions. It creates a policy that you can then share with your employees. And it is specific to your environment. And it then can be tied to the security risk analysis. When you go through that, you'll be able to select the policy that meets that requirement if it's a policy question. And if you have your own policies, those can be uploaded in as well. And finally, one more note, we've added in by request of clients a business associate agreement tracking item. So this can be added to a subscription for Medcurity where you can track all of your BAAs. You can push them out for electronic signature and see when those come back in signed. So you have a quick inventory, you know where to access them, and you get reminders both in the system and by email when agreements need to be refreshed or renewed based on your policy for renew dates. So that's the Medcurity platform. We have created a promo code, but please email me with any questions or anything else that you'd like to learn around that. We provide on-site support for anyone that wants that. Also, they can walk through it themselves if they are comfortable conducting their own security risk analysis. We have, through our website or social media, we have podcasts on a regular basis and live video where we talk through these type of key items that we see in the industry and new threats or new opportunities for us to ensure that we are protecting our organizations completely. So please follow along and send us questions anytime. We are at your service. And thank you for being a part of this webcast today. Thank you.